Polycystic Ovarian Syndrome, also called PCOS, is a hormonal disorder that affects women of reproductive age. It is characterized by the presence of cysts on the ovaries, irregular menstrual cycles, and an imbalance of certain hormones such as insulin and androgens, which are male hormones. Weight gain and difficulty losing weight are common symptoms of PCOS. The hormonal imbalances associated with PCOS can lead to an increased production of insulin, which can contribute to weight gain. Insulin is a hormone that helps keep your blood sugars in check, but when there is too much insulin around, it can lead to the storage of fat, especially in the abdominal area. Women with PCOS may have higher levels of androgens, specifically testosterone. Androgens can affect metabolism and lead to weight gain, especially in the abdomen. Weight gain associated with PCOS can also be influenced by other factors such as lifestyle choices, genetics, and individual differences in metabolism. Managing weight with PCOS can be challenging, but with the right approach, it is possible. Here are some strategies that can be helpful. Number one, focus on a balanced diet that includes whole foods such as vegetables, lean proteins, and whole grains. Avoid or limit your intake of processed foods and sugary snacks and drinks. Number two, get at least 150 minutes of exercising each week. Do a combination of both cardiovascular exercising and strength training. Number three, pay attention to your portion sizes and avoid overeating. Consider tracking your food intake to monitor your eating habits. Number four, choose foods that have a lower glycemic index to slow the impact on your blood sugar levels. 5. In some cases, your healthcare provider may prescribe medications to help manage your PCOS symptoms and promote weight loss. And lastly, consider joining support groups or working with a healthcare professional who specializes in PCOS management. They can provide wonderful guidance, support, and personalized advice tailored to your specific needs. Remember, weight management with PCOS is a gradual process, and it is important to be patient with yourself. Making lifestyle changes and adopting healthy habits can have a positive impact on both your weight and your overall well-being. If you are overweight and want to talk to an obesity medicine specialist about a plan that can work for you, please reach out to us at healthymeweightloss.com.